think we have to start. The topic, I don't know, I can't see the document from my own end again, but I think we should start.
Can you see it now?
Yes. Am I audible enough?
Yes, you are, sir. You're audible, sir.
Okay. I know we have audience here, so I would appreciate if somebody would let me know that I am audible to the audience as we start, please. Hello?
You are audible. You are very audible.
All right, thank you so much. Yes, the topic, as you can see, is nutritional strategies for the prevention and management of metabolic diseases in livestock and poultry. Now, like I said before, I don't think I have to talk much because I'll be expecting engagement in the way of the questions, contributions, and of experience sharing or knowledge sharing as the session continues. So on slide 2 is the table of content. I don't think I should take much time on that. So I will be proceeding to slide 3, where we have introduction. Now, the core goal of today's session is to understand how feed composition is a link to metabolic health of our animals. And looking at the key points, we're talking about high production demands, how high production demands increase metabolic stress, nutrient imbalance, cause subclinical or clinical failures, and how precision feeding prevents economic loss and boosts immunity of our animal. Now, going to slide 4. I don't know what is happening, but yes, we're looking at the overview. I would like us to look at this piece of information here before we dive into the topic proper. Systemic reviews of livestock diseases in Nigeria show that overall annual quantified animal health loss range widely from small farm impacts up to 700.3 billion naira. And presenting this in dollars, you have $456.9 million. However, specific nationwide monetary data detailing the exact economic impact isolated solely to metabolic diseases such as ketosis, milk fever, rickets, SIDS in Nigerian livestock and poultry are scarce. What it means is that broad economic loss data in Nigeria primarily capture infectious, viral, or parasitic endemics rather than non-infectious metabolic disorders. So for that reason, I cannot give an account of exactly what the losses accrued to metabolic disorders is, because there are no documented records. And I will suggest that bodies relevant to this should start taking account of how much exactly is the economic impact of metabolic disorders. So, having said that, or having established that, what is metabolic disease? We're on slide 5 now. What is metabolic diseases? Simply, metabolic diseases is a non-infectious internal disorder. A non-infectious internal disorder. It has nothing to do with pathogens such as virals, bacteria, fungi, protozoas, as the case may be. And my moderator, are you there? We are on slide 5 now, and I can still see slide 4 on the screen. Thank you very much. Now, it happens when the body's chemical and physical processes fail. And this failure is as a result of high production demands that forces oxidative reactions and causes energy and negative balance and fat, as the case may be. Rapid growth or poor nutrition as a result of either underfeeding, overfeeding, or poor composition of nutrients in our feeds. But unlike infectious illnesses, they do not spread from animal to animal. So even though the impact of a mortality in most cases are devastating, there is no cause for morbidity. There is no cause for morbidity. They may be inherited or acquired, but the latter case being more common and important. Yes, there are hereditary cases of metabolic diseases, but commonly, they are as a result of what is given in essence or not given at all, or what the body has failed to metabolize as a result of the certain factors that we will soon get into as we continue to dive into the session for today. Now, metabolic diseases are clinically important because they affect energy production or damage tissues that are critical for body survival. I believe that is already self-explanatory, that I don't really need to spend more time explaining. Now, having looked at what metabolic diseases is, let's also look at what a nutrients. Look at the nutrients and then see how they contribute to preventing and providing immunity for our farm animals. So we have a core nutrients breakdown. Top on the list is water. The importance of water can never be overemphasized. Of course, we know the volume of water in ratio to the entire body content. We know that it aids the digestion, regulates temperature, and handles nutrient transportation. So clean water must be accessible at all times. I emphasize clean water. Of course, energy and fats that are gotten from either carbohydrates or fats, proteins. I will also emphasize enzymes here, although I didn't capture it here, but then enzymes, a certain class of a protein that catalyze certain reactions or reactions in the body. Also, fibers and minerals. Minerals especially calcium, phosphorus, and the salt for bone growth and overall skeletal system. And then we have vitamins. Of course, we know fat-soluble vitamins, their roles, and also water-soluble vitamins. So I don't think I need to spend more time on that. Then, what are the common metabolic diseases that we encounter on the farm? What are the common metabolic diseases? Most commonly, we have milk fever, which occurs as a result of low calcium in the blood during calving. We have ketosis, which also occurs as a result of negative energy balance and fat breakdown during early lactation. Of course, we know what lactation means. And we also have a ruminant acidosis, which occurs when there is excess green and the low fiber, which drops the rumen pH. In other words, we are talking about a sheet that makes the rumen too acidic for good. We also have a grass tetany, which occurs when there is deficiency in magnesium. I believe I am still audible to the house, please.
Yes, sir, you are.
Okay, yes. So, what are the causes of these metabolic diseases in ruminants? Like I've mentioned briefly before, in most cases, it happens due to nutritional imbalances or high stress during early lactation or late pregnancy. And we had already mentioned ketosis, a high fever, bloating, which are the symptoms, and we have a grass tetany. Then common signs or symptoms include drop in field intake, muscle trembling, weaknesses, staggered walk, bloating, and a sudden drop in milk yield. So when you see things like this on the farm, then you really know what to start doing before seeking professional help, because in most cases, they are as a result of nutrient imbalance rather than infectious cases. So, having considered common metabolic cases in ruminants, let's also briefly look at major metabolic diseases in poultry. And what are they? Oftentimes, we talk about prolapse, all right? We talk about prolapse where you have your birds having tears after laying eggs. In most cases, they even die trying to lay eggs, all right? And when they die and the PS is done, you see that there is a fat accumulation in some critical parts, of the viscera. So that is what we mean here. We also know about liver rupture. Liver rupture. These are typical symptoms or cases of fatty liver hemorrhage. And of course, they occur when there is high energy or excess energy intake that the body cannot utilize immediately. And then it turns to accumulate into fats that cause serious problems. Also, cage layer fatigue. cage layer fatigue, when your birds are paralyzed on cage and all of that. In the case of the broilers, we have a disease, which is caused by rapid growth, leading to high excess demand and metabolic, strain. We also have tibia dysphorodrome plasia, which is also as a result of the mineral and the vitamin D imbalance affecting bone growth, as I mentioned before. So, how do we address this from the nutritional point of view? Being that nutrition has a lot to do with prevention and the management of the above mentioned challenges in our farm animals. Now, a core nutritional schedule for ruminants like sheep, cattle, and goats relies on daily dry matter intake of 2% to 4% of body weight. This daily intake requires a balance of 60 to 80% fibrous roughage for rumen heads, paired with first energy, protein, water, and mineral supplements tailored to specific life stages. Now, what it means is this: your feed schedule has to do with one, age of your animals. So age of your animals, condition of the animals, be it pregnant or not pregnant, or whether it is being fattening for sales. So you have to put all of this into account before coming up with exactly what to provide for your animal, as the case may be. So we talk about roughages or forage. This is especially for cattle farmers who graze their animals. Those animals are mostly free-range animals that go about eating pastures in the field. However, there is a need to supplement them with minerals. What I see others do in the field is that when they don't have access to, or whether they don't have access to, or they don't want to use a mineral block, they use a normal salt in supplementing the required minerals. There is always a spot meant for that, and the animal, as a result of consuming it for a while, they know exactly where it's being placed. So after grazing, they come back, go to the spot, lick the salt, and all of that to provide essential minerals for them. Like I also said before, clean water importance of a clean water cannot be overemphasized. So there has to be clean water at all times. And the third point here, I've already mentioned it before, but I want to emphasize the ratio of a calcium to phosphorus in the body. It has to be 2 to 1. 2 to 1. Because phosphorus potentiates activities of calcium in the body. So the ratio has to be maintained. Yes, one would wonder how I'm going to get things like this right. But then it is always important for farmers to employ or engage the services of qualified people, especially nutritionists, who can do justice to things like this, as it will save them more than waiting for issues to arise before running up and down, helter-skelter for solution. And then we have what we call first feeding schedule for ruminants. First feeding schedule for ruminants. Remember, I mentioned earlier that what you feed your animal for preparing certain nutrients for your animals has to do with certain things: age, their condition at the point in time. And I've listed some here in slide 11. And they include maintenance phase, which has to do with the non-lactating or non-pregnant animal. In this case, they are expected to have 100% forage-based diet. They are expected to have a standard trace mineral and salt blocks. I'm going to repeat again that I've seen in cases where, or places where farmers either they do not have access to mineral blocks, or they have, but they prefer to use a common salt. They make provision for it to supply the minerals that are required for their animal. And then early to mid pregnancy, there is also a different nutrient requirement during that period. Same with late gestation, which is about 6 to 8 weeks, and depending on the animal. By this I mean whether it is a cattle, cattle, sheep and goat, or even swine. You have to factor this into account and then see what is required for them at a particular point in time. And then lactation, during lactation, where there are the peak of a nutrient requirement window, you also have to factor in what they need, how they need it, and then provide it in high quality. And in most cases, what is provided is from legumes, energy, protein, grain concentration that in most cases are sourced from maize and soybean meals. So they're expected to be calculated in order to match the milk yield volume of the lactating animal. And also, like I mentioned before, for those just fattening their animals at the fattening phase are expected to consume high energy concentrate rations scaled up gradually up to 2 weeks, starting at 0.5 kg per day to prevent acidosis, backed by 10% to 20% roughages for safe digestion. So let's look at the daily ration for daily feed rations by age and type in poultry. I think this should be the easiest because the information on this is already viral. That's one. And two, our feed millers are also doing justice to this by producing and distributing different rations in the market. As we have chicks, starter in the form of a crumble, pellet, and as the case may be, grower layers and finishers as the case may be. For broilers, layers, and then growing birds to laying stage and all of that. So I don't think I need to spend much time on that. So what are the major metabolic disorders in swine? Now, I have a farm. I have a farm here in Ekpe that lost about 50 piglets in the last 3 months. And what is the problem? They have been to the lab. They have done everything recommended by the lab. You know, they have administered treatment. We use toxin binders, acidifiers, and all of this. So one day, I say I would like to take a look at the what they are feeding the feed with and their feed formula at the same time. But what I discovered was a very, very shocking and pathetic. In fact, it was as bad as what they were looking at or using as a fish meal was just the ordinary cassava flour. And so sometimes the pigs we have a stillborn, or they will deliver them, they will farrow them, but then they will die shortly after farrow. So I had to intervene and then come in with a proper thing to do. Now, in the first instance, the animals were being underfed, and when they increased the feed composition was all balanced. In fact, there was nothing like the fiber. Even crude protein was lacking. So please, like I said before, it is always important to consult a professional who knows what to do to prevent the losses. In the last 3 months, the animals have been eating and all of that, but then nothing to show for it. So what are the common metabolic disorders that we often encounter in feed? I mean, in swine, we have a neonatal. We're talking about what occurs in piglets within the first few days of life due to inadequate milk intake or chilling. Signs include a shivering, weaknesses, cold skin, splayed legs, coma, and eventual death. Like I said earlier, when imbalance in nutrition is capable of doing so many things on the farm. So please, let's take note. We also have genetic defects that are triggered by physical stress, transport, or high temperatures. And the signs include muscle tremors, rapid breathing, extreme body heat, blotchy skin, and sudden death, as the case may be. All right, so because of time, I just want to rush so that I will still have time for interaction, as I said before. So let's look into the general prevention of these cases. Now, first of all, environmental control is very, very important. You have to maintain warm farrowing areas using heat lamps, as the case may be, to prevent the chilling and hypoglycemia in newborns, like what I just explained above. Very, very important. Like I said before, your expert will guide you in going through situations like this in order to avoid, a serious losses or complicated situations of the farm. Balanced nutrition very, very important. I've said it before. Ensure gestation and lactation diets are properly balanced with calcium, phosphorus, vitamin E, and selenium. Very, very important. Access to water. Provide continuous, unlimited access to clean drinking water to prevent salt poisoning. Genetics selection is also very, very important. And then for poultry, especially, management strategy during times of stress are also important to put into consideration. Of course, it is common knowledge that during the cold seasons, energy level of feed is adjusted and the vice versa, So in addition to that, during heat stress, lower high fiber ingredients should be used to reduce internal heat increment. Use of vitamin C, vitamin E, and electrolytes, potassium, sodium are also very, very important. That's electrolytes, And during the cold stress, increase in the dietary energy density that are derived from corn and fat to support body temperature maintenance. And also, I repeat, access to clean water that you can drink comfortably without issues. Hydration, very, very important. Then, conclusion and actionable takeaway points. Now, the summary of what we've been discussing here or what I've been saying here in the previous minutes is prevention is cheaper, safer than treatment. So if you are to take what I've just briefly discussed here into account by applying it, you save yourself a lot of headache, a lot of resources, and make very huge margin. So what are the takeaway points here? What should we do? Regularly test feed ingredients and forage quality. All right. What do I mean? Of course, we have cases of people using contaminated feed ingredients that cause a lot of havoc on the farm. Talking about aflatoxins, among others. All right. So regularly test your feed. Also, watch out. Like I said before, somebody was busy using cassava flour, thinking it's fish meal. I wonder how managed, but then it's what I witnessed myself. It's all what I read somewhere. I witnessed it myself. Adjust your rations dynamically based on production feeds. I've mentioned all of that above. Non-lactation, lactation, fattening. Always put that into account. That should guide you on what and what to provide and at what time. And last but not the least, on this list, consult a professional. Consult a professional. In this case, a nutritionist for custom flock and herd balancing. So at this juncture, I want to thank you so much for your attention. As I expect contributions, questions, and answers at the same time. Thank you so much once again.
All right. Thank you very much, sir, for that insightful presentation. I'm sure everyone has taken away some valuable information from that session. We'll now move into our Q&A session. If you have any questions for our speaker, please feel free to drop them in the chat or use the raise hand feature, and we'll take as many questions as time allows.
Thank you so much.
Hello.
Okay. Hello, Mr. Fidelis.
Yes, sir.
Yeah, thank you so much for the wonderful presentation. It's so enlightening, and I hope that we've learned so many things from here for those of us that came in on time. I hope we've learned one or two things, and I just want to also mention, just like you said, that prevention is cheaper and safer than treatment. You, while you were talking, you mentioned something about storage, right? If I'm correct.
Something about what?
Storage.
Oh, yes.
So the importance of that cannot be overemphasized. If you do every other thing right and your storage is not top notch, it will mess you up, because if you store feed material in a damp area, it can predispose those materials to fungal growing of mold, which you breed fungal, and the animals can come down with fungal infection. And the most devastating thing is if the the farmer is not able to diagnose that it's fungal is dealing with. They will just be using several antibiotics to no avail. Animals might be dying or animals might be moribund, and yet they will keep spending money and they will not get results. So that's just what I want to talk on. Thank you so much.
Thank you so much, sir.
You're welcome.
Mm.
Do you have any other questions or additions for Mr. Fidelis?
Mr. Fidelix,
Yes, sir.
thank you very much for that awesome presentation, sir.
You're welcome, sir.
I would like you to give us more example of metabolic disease, sir, so that we can really understand it better, sir. That's
Okay,
example. Yes, sir.
more examples of metabolic diseases.
Yes,
Yes,
sir.
thank you, and thank you very much for the question.
Yes, sir.
Yes, I will first of all like to note that we are in a seminar. Let me put it that way. All right. So we might not get every information. That's one. And two, most of these things are professional. That they will require professional contributions, like I mentioned before, to be identified or diagnosed. So the most common ones that one could one could identify as a way of experience. But again, it is not just enough for you to diagnose based on experience. All right. In other words, assumption is risky. Assumption is risky when it comes to health. All right. So, yes, there are others, but the most common ones that an experienced farmer can speculate. Underline that word, speculate, because you can't be sure until it is confirmed by a professional or a diagnostic lab. All right, but the milk fever that I mentioned is very, very common. Ketosis is very, very common. Acidosis or alkalosis are very, very common. Bloating and all that. For what is it called? For ruminant. Or in addition, I can say add arthritis that I didn't capture here. All right, so that is the one thing that I remember that I didn't capture, and it's very common. So please, the best bet for you is always to seek professional help. I think that's what I can say. I'm sure there are other experienced people here. One or two, somebody might also have something to add or answer better than I have. Thank you.
Okay, Dr. Adisa, you want to throw more light on this? Please go ahead, sir.
Thank you very much. I'm delighted to be on this Zoom link. And just to throw more light on that metabolic disease has been said. When we talk about metabolic disease in livestock, livestock generally we have poultry, large animal, which comprise of cattle, sheep, and goat, and the likes. And individual diseases are different depending on the species we are talking about. But majorly, since we are considering large animal now, in dairy cattle, we can talk of ketosis. And when you talk of ketosis, what we normally see to show to you that the animal might have a problem with metabolic diseases. Can you hear me?
Yes, we can hear you, Doc.
Reduction in appetite, and happens to be an animal that is making, level of that will be reduced, and there may be weight and some other clinical signs, and that's for dairy cattle, And like I said, that we have various clinical manifestation considering the livestock we are talking about, and also in cattle and sheep and goat also we can talk of hypophosphatemia. Since it's a metabolic problem, there will be reduction in intake or increased demand for phosphorus, which can also be corrected with diet. You increase the level of that phosphorus in the food given or the feed given to the animal to help in that. And if you bring it down to other animals such as poultry, you can talk of rickets or osteomalacia, which are oftentimes seen in younger ones when they are growing up, and that can be as a result of vitamin D, calcium, or phosphorus deficiency. So depending on which other species we are talking about, metabolic disease is very wide and broad. So we need to narrow it down with what we are discussing, whether it is for livestock, majorly cattle, sheep, and goat, large animal, or we are bringing that to poultry. And when you have such cases and you see such clinical signs, you look for how to get the problem solved. If in the case of calcium or phosphorus deficiency, there may be deformity in their bones, and that might result in lameness. I'm talking about rickets in poultry. So once you see those clinical signs, you can confirm that is a problem of metabolic disorder, which can be corrected through diet or medically also. There are some drugs that can be given to help to improve that. So thank you very much for the opportunity to just throw more light on this.
Thank you so much, Doc. You're welcome.
All right, thank you very much, Sarah. Thank you so much, Mr. Fidelis, for taking the time to share your knowledge and insights with us today. We truly appreciate you, and thank you to everyone who joined us this evening and participated in the discussion. We hope you found today's session valuable and that you're leaving with practical knowledge that you can apply in your work and livestock management practices. On behalf of Kachelan-Pharma Research Limited, thank you once again for joining us. We look forward to having you at our next monthly community webinar. Have a wonderful evening, everyone, and stay safe. Goodbye, and thank you for joining us.
Bye-bye.